Hello. Good morning, everyone, and welcome again to the series of lessons on Introduction to Healthcare Management Principles and Practice. I'm Dr. Usha Manjunath, Director at Institute of Health Management Research, Bangalore. In the previous lesson, we learned about organizations, and this is session 2, Introduction to Management. Moving ahead, what is the content of this particular video? First, I'm going to review on the previous lesson very briefly, and moving ahead, we will learn about what is management, how do you manage yourself, and what are the management goals, efficiency, effectiveness, and productivity, and what are the levels of management and how that impacts what we do to the overall function. And then functions of management. So what do all managers do? And then there are functional areas of management, which means there are specialized areas that each manager may work. So somebody could be a sales manager, somebody could be an IT manager. So that's what we will look at, the functional areas of management. And what are the managerial competencies? And finally, roles and responsibilities. And then look at who are the managers responsible for and what are the stakeholders and their expectations. Review to the Introduction to Healthcare Organization from the previous video. In the previous session, we learned what is the Indian healthcare system, and then we said there are various aspects of healthcare delivery, that there are public healthcare delivery system, and then there are private organizations. So whether it is from the central government, the state government, and ESI and various others, from the public system to the private for-profit and not-profit organizations. And then we also learned about the healthcare ecosystem. So we have healthcare provider systems, but then is it enough? Then there are a lot of support and various organizations who have to work in tandem to make the healthcare ecosystem very robust. That is, the core of any system that we are looking at is that the patients or the enrolled populations and community aspects of health. So the first layer is obviously the healthcare providers. It could be health centers, health systems, hospitals, and the next layer would have biotech, medical devices, equipment, pharmaceuticals, consulting, IT, AI, and so on. And then they have to be governed. There is a legal system, the local government, that has to be funding, federal government or state government, and insurance. There are employees, accreditation groups to ensure the quality of the care that is given. And then finally, how research and professional associations, education, and foundations prepare the healthcare providers to ensure that the right things are done. So healthcare ecosystem is the most important part, that when they work in tandem, then the people or the patients enrolled will get the best healthcare. At the individual level organization, what are the characteristics is one important thing we learned. A formal organization is a legal entity. So, for example, there has to be business registration, tax identification, maintaining corporate book of records, and so on. The persons or people who start the organization are often called the founders. The ownership organization varies. Sole proprietorship, partnership firms, private limited company, public limited company, Section 8 company, and so on. So now we kind of move ahead to learn about what is management. So if we talk about myth or truth, is management all common sense? Well, yes, partly true. Management is also all common sense, but it is all about business sense too. Is management all arts or is it all science? Management has a lot of science in it, as well as when a manager actually works, he is doing it more innovatively, he becomes like an artist. Management didn't exist in ancient times. It did exist. If you remember, how Taj was built or how long it took and how they really organized, building of such a beautiful monument over the years. Definitely there was management across. Is it only for private companies? No, management is universal. It applies to small, big, public companies, all aspects of different companies, private, public-private partnership companies, and so on. So we generally say management applications of management skills, knowledge, and competencies are universal. We also manage at our own level, right? So we manage our health, we manage our diet, we manage our kitchen, relationships, finance, and so on. So we kind of are all in some fashion know what management is, but then we need to be very specific. Managing self is the first starting point to move ahead and manage an organization. So I like this very much. स्वास्थ्य के 4 सूत्र: आहार, व्यवहार, विचार, and आचार. So if we want to manage organizations and become effective managers, we have to start with ourselves. We have to manage our own selves well, and then really think, this helps us to perform much better as managers in organizations. Ahar is obviously food and the diet that we have. Vyavahar is relationships, how we deal with people, how we interact with people. Vichar is our thinking, cognitions, what we think, what kinds of knowledge we have. Achar is our behavior, habits, how we function on a regular basis. Are we disciplined? Are we able to really do things in a regular fashion? So I think this, if we are able to incorporate in our lives, we will also be better managers. Well, now let's talk about managing an organization. So we all kind of keep talking about what is management, what is management. Management involves coordinating and overseeing work activities of others so that their activities are completed efficiently and effectively. So there are very important aspects that are highlighted in this. So as managers, you will be coordinating, overseeing, monitoring all the activities to be completed efficiently and effectively so that the purpose of the organization, the goals of the organizations are achieved. Management is also all about how we manage resources. It could be knowledge, skills, information, people, time, funds, technology, equipment, medicines, consumables. So in general, we also talk about 3 M's of management: money, manpower, and machine. So now what is this efficiency and effectiveness in management all about? So efficiency is, how we use the resource. So it is the means to get the ends, the effectiveness. So we have to really look at, in terms of resource usage, that means we have to optimize, we have to waste less. Only then, we will be able to, kind of have a high efficiency, which will give us cost advantages. In terms of effectiveness, goal attainment, and so that means I have to have a high goal attainment, and then we say high effectiveness. Say for example, for a teacher like me, if I finish all the syllabus, all the portion in time, the number of sessions given to me, I'm efficient. If all of you understood, then I also have effective teaching skills and I'm effective in teaching. If not, I'm not effective, but maybe efficient. So effectiveness will also have aspects of efficiency built into it. So it's very important to understand that efficiency and effectiveness are the 2 very, very important things. Moving ahead with that, then what do we really achieve? So managers are always looking at the goals of productivity. That means it is an input ratio within a specified period with due consideration for quality. So productivity is equal to output upon input and the quality level specified. So you need to ensure that just because I want to do fast, if I make more errors, then that is not productivity. I have made more errors, and therefore my outputs are not of high quality. So productivity can be increased by increasing output, maintaining the same levels of input. Increasing output and decreasing inputs. By decreasing input but maintaining the same output. So that means I can do optimizations, I could do faster, I could get trained, I could really enhance productivity of any organization through various means. So let us look at how to increase productivity in the workplace. So the first two important things is optimizing all your resources that we talked about, including time, right? So if I'm able to optimize, that means I'm not going to waste, I'm not going to use more, I'm not going to use less, but then the right amount to provide at the high quality output. So if I get skills, so if I'm trained, I will make less errors. I will also have things done faster. And then if I have the right tools then again my productivity will improve. And if I have the right technologies, say for example, if I put certain technologies which may fasten my ability to do, then again I will be able to do better, faster. Right? So we talk about AI and so on. So there could be various ways that productivity can be increased. So the reasons are you will be able to achieve high output at a good quality, and then you will reduce the cost, and so your production numbers may go up. You may be able to scale, and you may be able to achieve economies of scale, and therefore finally you will have better volumes of production, or you will have better outputs, and then you will be profitable. So let us now move on. So we know now what is management, and then what are goals of managers and management. And now let us look at what are the levels of managers in an organization. So if we really look at, there is at the bottom is the workforce. All of us who are working on the shop floor maybe, and various other departments, so maybe we are not we are in the teams, but maybe we are not the supervisors and next level managers. So there is the first level managers, or the lower or the operative management. So for example, supervisors, junior managers, inspectors, clerks. So these are the people who oversee the immediate aspects of the work that are done. So then is the middle management. So they are the next level managers who will be supervising these sets of people and will be on the functional area. So marketing manager, purchase head, sales manager, operations manager, branch manager, finance manager, and so on. And then there is the topmost level managers, who are the sometimes often referred to as C-suite. Chief Executive Officer, Chief Marketing Officer, Chief Sales Officer, and so on. So what does this really tell us? So as the, we move up, of course it tells you a lot of things in this pyramid, if we really look at. So the responsibility goes on increasing, and your accountability becomes more and more, of higher value. And then authority flows. That means the decision making will be top. Management will have the highest decision making, and then the decision making slightly comes down. It means that you are more and more responsible as you go up in the ladder, and it also becomes a lot more difficult to move up in an organization. That means there will be lesser and lesser jobs at the top level. So you have to perform very well to move up. So then it also talks about authority relationships. It also talks about the communication. So people communicate across, and this is a very important concept in management, that it is in a pyramid shape. It is a representation, but it also represents that there will be less and less people as we move up. So now what you can do is take this as a small exercise, that what are the different levels of managers in a hospital where you work or where you are studying. Moving ahead, what are the functions? So now we understood about, okay, what is management? We have to look at costs, we have to look at managing resources, we have to reduce wastage, we have to increase efficiencies, we have to achieve the goals, very high levels of achievement of good quality, increase productivity, create surplus. All this we kind of understood. So to do that, what are the different functions of managers? So management functions, I sometimes call it also as management mantra: planning, organizing, leading, and control. So what is planning all about? It is setting objectives, what I want to achieve, when, by what are all the things that go into it, where am I actually going to do it, and all this, and then keep certain specific objectives so that I will be able to track it well. Then what are the strategies? How am I going to do it? That's very important. Let us say for your hospital, you want to get the laundry work done. So there are two different strategies. You can hire laundry people and have a department only, or you could outsource. So you will plan accordingly based on the costs, the advantages you will have, but your goal is going to be good. The goal is that your laundry services will provide for all the requirements of the hospital at a very high quality, cleanliness, hygiene, and so on. So the strategy is, do you want to do it yourself or do you want to outsource? That is the strategy. And then you further plan for the resources. Where do I get manpower? What are the types we require? So you do a lot of budgeting, you do manpower budgeting, financial budgeting, like the required times for the machine usage and so on. And then how do I organize work? So this is like, organizing HR and organization structure. So remember we saw one small diagram on the pyramid. So who's going to be doing at different levels? Who are the people who are going to work at different, organization level, positions, and so on. So you will identify the jobs, who is going to do what, work division, create departments, assign duties, establish reporting relationships. Under leading, once you have put people, you have made them in a particular structure, and then you have the motivation, leadership, communication, individual, group, and work behavior. So you have to pay attention. You have to not only now manage, but you become leading people, leading team, and you have to encourage them. People have their own problems. You may want to identify what trainings they require. You may want to encourage them. You may want to ensure there are no conflicts. So you become a very important person to actually get the work done. And then control, or the how to measure the performance. So you set performance standards. So this is what level I want to achieve, and then you measure the performance and take corrective action. So for example, in a hospital, communication is primary to all these functions, and culture is the DNA of an organization. We already learned it in the first lesson that the culture and communication forms the core of any organization, a DNA. It becomes the DNA. So you want to do planning, organizing, leading, control, but then you need to communicate very well. You have to have the best the culture for the work culture that you want to set. So you want to know the team, doctors, nurses, technicians, administrators, and so on. And then who's the focus? My purpose is to treat patients, to take care of them. So you are looking at outcome, quality, satisfaction, hospital care that you do. They have to get well soon, and they have to be functional, get back to whatever they were doing faster, and then their quality of life, their overall quality of life should also be good. So you will kind of look at how you are going to plan patient care, how are you going to organize as departments maybe, then what are the motivational ones, is it salary, is it various other aspects, and then what are the outcomes that I expect, how do I really measure those outcomes, so in a hospital you will measure how many people came, am I treating more people, but then are they getting well faster, are my IPD patients going home faster but healthier. So these are, you set a lot of performance standards, indicators and then measure them, and then that's how the, as managers at every level, every manager, whether it is the junior level, mid level, or top level managers, everybody will be engaged in planning, organizing, leading, and control in their own work areas and work goals and setting it up. And now, what are the functional areas of management? So, do we have specialized management? So, what I mean to say is, HR person specializes, HR manager specializes in HR, but they will also do planning, organizing, leading, control. So, that's all something that I want all of us to kind of understand. It's very easy if you are given a project, if you are given something to do. So, you say, if you're a HR manager, you plan how many people I need. How do I have my department? Okay, who's going to recruit? Who's going to put the advertisement? How am I going to do the interviews? So you are going to have different people doing different things and organize the work. And then within the department, you encourage, lead them. And then you say, okay, so was I able to fill all the seats? My control and performance. So, this will apply to all areas of specialized managers. So you are HR manager, marketing manager, customer service support, sales, accounting and finance, distribution, research and development, administrative and management department. So these are all functional areas. Production manager, operations manager, IT support manager, purchasing, legal department. So these are all managers and management areas where there is specialization. So you kind of get, more and more skilled, more and more, doing the same kind of specialized work. Moving ahead, what are the competencies do managers require to perform effectively? So one of the things is that competency is a function of knowledge, skills, and attitude. That is, K is a function or competency is a function of KSA. That means you have to have the knowledge, the information, maybe some theories, but then you have to perform well, you need to have skills too, and the right set of attitudes, positive attitudes, in terms of really including everyone in your work, and so on and so forth. So moving ahead, we could put that knowledge, attitudes, and skills as an aspect of matters of the head, heart, and hands. So head is about thinking, knowledge, analysis, decision making, all the tactical things that we do. Heart is about effort, resilience, respect, motivation, commitment. So it forms the attitude aspects of it. Skills, hands, is often associated with skills. So you have skill development, application, fitness levels, techniques, competitive aspects of it. So you kind of want to acquire the skills. Of late, people are talking about employability, and where Indian students, for example, are not ready for employability. That means maybe we are, taught a lot on knowledge, but maybe not so much on improving our own soft skills and attitudes and the technical and other skills. So now there is concept of even finishing school concept which is coming by. So as students, as you learn the management, be very sure, if I want to plan, what are the skills required? Do I know how to analyze the market? Do I know how to set a goal? Do I know how to make a budget? So these are the skills that are required to be an effective manager. And then maybe theories, but you know how to do planning, you have to set targets, but then do you know in reality how to do it in a given situation? So these are very, very important. Moving ahead, do all the skills are required at different level managers of equal quality? How does that really work? So we again go back to our, very famous pyramid, where we looked at, workers or the workforce as non-managerial employees, first line managers as supervisors, next is the mid-level managers and the top-level managers. So if I really see the drawing or the representation on the right in red, what it says is there is conceptual skills, human skills, and technical skills. So if I ask you a question, where do managers require all of them of equal quantity or quality. So you see that human skills every manager requires, and no wonder that we have all management schools, managers who are working, often referred for training for soft skills, communication, interpersonal relationships, how to talk, how to interact, how to negotiate. All the human skills are most important across. And then of course technical skills. If you're lower level people or more technical people, they are like very sharp, they know what to do. So as I move up, maybe I will require larger conceptual skills to implement. Say for example, I need to see, okay, so this is the department, how does the work of this department really fit into? So the conceptually I have to look at the big picture. The big picture for a first line manager could be the department and the organization. Again, the middle level managers immediately will be looking at how do we really are we really achieving or not. And the top level managers have to have the most conceptual skills, in the sense they need to understand the industry, what is happening outside, as well as what is happening from the organization itself. So they have to kind of place their organization in the larger sector or in the larger ecosystem and constantly look at improving and performing better. So their competencies would be a lot more in terms of understanding overall, maybe the health sector itself, maybe the private health sector, what are the new rules and things that are happening from the government. So the top managers' conceptual skills are very critical. Um, Moving ahead, what are the roles and responsibilities? So a manager is an individual who occupies a position of authority within an organization and assumes the responsibility of overseeing and coordinating the activities of a group of individuals or a specific department. So their role is essential in planning, organizing, leading and controlling various aspects of the organization to ensure the attainment of goals and objectives. So you could say, well, I have to set the goals. So number one, goal setting and objective alignment. I have to strategic planning, long term I have to see, and then efficiencies I have to bring in the organization. I cannot waste, I cannot, lose money, lose materials, waste things. I have to make informed decisions. I should be, really looking at what really is the choice that I have, and then what is the right choice and what should I really do. And then I have to be skillful delegation. So, can a manager do everything by himself? No, he has to delegate to his teams and juniors. And then guide and support, leading we talked about. Then team representation, you become the very important part to show that you are the, like a kind of a figurehead. So if we go back, so once after that is your performance management, communication facilitation, conflict resolution, development and learning, promotion, as well as a team representation. So you have to be really owning up to what you do, what is your team all about. So there are a lot of different roles that you play. Mintzberg is a kind of a management researcher and a practitioner and a specialist who talked about and organized based on his research 3 important key managerial roles. One is interpersonal roles, informational roles, and decisional roles. So interpersonal roles is that a figurehead. So you represent your department, you represent your organization. So like say for example, a CEO of the organization will also maybe attend the the lowest level managers family very important function maybe. So he means that I am the figurehead in the sense I represent the organization, we mean well. So we all know figurehead of a family. Similarly, we represent that, and that is the most important one. And as a leader, of course, all of us who work at any management level are not just managers. We have to be leaders, we have to be motivating people, supporting people, encouraging people, training them, and really coordinating very well. Liaison is across within the organization and various levels of managers that you may have, various levels of people, but outside liaisoning is also very important for effective functioning and management. The informational roles cannot be really ignored. So we as managers monitor, we also disseminate information, and spokesperson, that means whatever work department that we do, we act as spokesperson, we kind of communicate to others within the department. But any organization sometimes may have a identified spokesperson, but we also speak for our department, we speak for the work we do. So we become the spokesperson, we say what the others should really know in a very concise, very effective manner. Decisional roles as an entrepreneur, you become like very importantly like new things, new novel ideas. As a disturbance handler, like a conflict management and managing and disturbances. Resource allocation is the most important decisions that you will make. So in a hospital, how many people should I put on the floor, how many in the ward, nurses in the ward, and so on. So resource allocation is the most important decisions. And then you negotiate, whether it is the work negotiation within the organization, it is the vendor management and negotiations outside. There's a lot of important roles that we play. So as I move to the next slide, I also want to say, as students, you may be a friend, so you also have different roles. You are a mother, maybe you are a father, you are a son, daughter, a friend, sometimes I say a foe or an enemy. So you have different roles. So you kind of know how to really effectively function as an individual. Similarly, managerial roles, you will have responsibilities. To fulfill those responsibilities, you need to assume various roles to really achieve the things that you are set for you. And who are finally looking at, as managers, who are we really responsible for? Who are these stakeholders? And who is a stakeholder? And a stakeholder is a person, group, or organization with a vested interest or stake in the decision making and activities of business, organization, or project. So stakeholders can be members of the organization, they have a stake in, or they can have no official affiliation. Say for example, the community could be a stakeholder. Say there is an organization, they generate a lot of jobs, so the community around also will benefit. All right. So they may, the community itself may not have official affiliation, but they also get jobs. So therefore, then the employees become a very formal stakeholders, but the community also benefits directly or indirectly. And so therefore, they are very important stakeholders. Stakeholders can have a direct or indirect influence on the activities or projects of an organization. Their support is often required for business and project success. So, so there are internal stakeholders, employees, managers, board members, donors, investors, owners, external stakeholders. And then among the external stakeholders, you have customers, suppliers, government agencies, creditors, labor unions, and community groups. So, who are you really responsible for? Obviously, there are people in the very key priorities are there. Customers are your priority, your employees are your priority, suppliers are your priority. So you will prioritize and see, what to really map their stakes and how to really ensure that you manage all their interests. So in a health system, say for example, if we take, there is a policy maker, payer, provider, and patient. So stakeholders are individuals or groups who have interest in a sector such as the health system. They can influence decisions, share policy, create an environment that best serves the needs of those involved in the sector. So let us see, what are these very critical aspects. So if I look at from the viewpoint of a policy maker, so now, what do I have to do? There is a payer, so I have to regulate the coverage. Policymakers establish the eligible beneficiaries, patient costs, and the portfolio of insured services. So the policymaker will look at, various aspects of, who should be in the, eligible beneficiaries, and how should the pricing be done, and what all should be the services. Should we have IPD or the hospitalization services? Should we have OPD services? In India, OPD services are less insured. So the policymakers takes these decisions. And then what does he really want to do with the viewpoint with the patient? He wants to do that, regulate the coverage, at the same time maximize the health of the patients enrolled. So they want to maximize the population health. They operate within the system's resource constraints, and they marshal new resources as they can. So they are interested in patients in a particular fashion. They want to regulate the coverage with reference to the payer, and then with the provider, regulate the service providers with reference to regarding who can legally provide health services within their jurisdiction. It could be in terms of licenses and so on and so forth. So so therefore every stakeholder is really looking at, there are relationships between these stakeholders. So payer's viewpoint. So if I look at from a payer perspective, so now, he has to deal with the regulated service. That means payers must conform to applicable legislation and policy. So whatever he does, all his activities should be within the purview of the policy as well as the legislation and the regulation. And now, how do I really work with the providers? So they are the one level of customers. So payers want to pay for efficient, high quality. So the provider could be different groups, different hospitals, different types of healthcare organizations. And so we want to provide for high quality, cost effective services for their beneficiaries. So now if I'm looking from a payer to provider, there are both two-way things, and that really happens. I want to standardize. I want to look at the various things that are there. So I want to specify the quality. I want to say what can be done, what can not be included, and so on, in terms of the care levels based on the how the provider actually provides. And then there is a patient. So with reference to the care funder, payers need to be financially sustainable, and they must minimize the cost for the benefits package offered. So so whatever that I'm offering to the patients, they should be affordable, kind of genuine in terms of how I'm really doing it. Now finally, the provider perspective. So if I'm really seeing, so we become the suppliers for the payers. So payers will have reporting and invoicing requirement. Example, level of detail, frequency, what we did. We have to put the procedures done. Healthcare provider has to do that. For example, amount, the speed, what were the procedures done. So I have to really report to the payer. And then with reference to patient, care provider has the most critical role. And then clinicians provide care to their patients, sometimes as members of the care team maybe, or individually. All right. So now the policy maker. So with reference to provider to policy makers, we have to conform to applicable legislation and policy. It is with reference to the maybe I'm just talking as an example from insurance, but not only that, also as a legislation and policy, as my skills as a doctor and so on has to be also standardized. I have to have the credentials, proper ones, and licenses and so on. So I have to really have the regulations and follow with that. So now, really, like, we saw the very important part. So we have, so everywhere we look at from a patient perspective, if I really look at, he can also influence. Many patients are voters and taxpayers. So I can also say what should be the policies. I can influence, I can kind of say, no, this is how much we can pay. So there is a part of that. So with reference to the payer, we are care seekers. Care seeking behavior is influenced by the numerous factors, proximity, fees, quality, and so on. If the cost is very high, I may seek something else. I may not really go through the same program. So care seeker will also have certain health seeking behaviors, care seeking behaviors. And then with reference to provider, I will have a two-way relationship where I'm also going to look at as a care seeker. how I'm going to really look at what he's going to charge me, how he's going to treat me. But I'm also like, patients want to be, we want to become healthy. We also want to know that we will not suffer from catastrophic financial hardship. So I want to get well. I want to ensure that this is the right treatment, right provider. And then with the payer, we pay for the insurance. We directly go through taxes, or they may have a choice of the insurance. So this is the most important aspects of management, where you have various stakeholders and how every manager really manages stakeholders at different levels. So this is like stakeholders for patient healthcare data. Nowadays everything is, we are talking about healthcare data, who owns the healthcare data, and so on and so forth. So does the hospital own the healthcare data of my data as a patient? So there are a lot of issues, but then there are various stakeholders. So if you are working with data and also working with digital data of healthcare, so there can be many stakeholders involved: the hospital administrators, doctors, clinical labs, patients, insurance companies, government department, networked hospitals, public health departments, NGOs. So you can go back and study and kind of do a small exercise on how does your health information management information system will ensure that only right set of data is accessed by the right people, and that all the clinical data is not leaked, and so on. But then for facilitating care, there could be various stakeholders for healthcare data. So we should have the right amount of data that we get to ensure the patient benefits at the end and gets the right amount of care that is required. But then, what are the expectations? All right, if you're a healthcare manager, you want to really ensure that there is optimized patient access. So patient has access to coming, and whether it is in emergency or in regular times, you have proper access to the healthcare facility. And increased resource productivity, focused patient safety is very important. Safety, patient safety and quality are the most important for healthcare managers. Maximized revenue generation, so we would definitely want to make profits. So reliable process quality, and engaged and enlightened staff, and constantly people are learning and doing better and better. Efficient resource utilization, superior clinical outcomes you want, so you want to track what is happening. Decreased denials and increased collections of your revenues. Declining patient wait time, patient don't want to wait, so you want to work on the process, you want to work on the outcomes, you want to work on the infrastructure to ensure. So these are the expectations across for healthcare managers. And of course, enhanced patient experience. Once they are in the facility, what all they experience, are the people treating them nicely, are people talking to them, communicating to them, giving the right information. So how are they experiencing various areas? Because healthcare is not just like buying one's pen or pencil. You have to go through the process. So how do they experience at each level as they're going through? So you have controlled operating costs. Are you able to cost control? And so there are a lot of expectations from the managers, and therefore understanding productivity to efficiency, to our own skills, to be a good manager, and how understanding the functions and the purpose of the organization, any healthcare organization, will definitely improve your own functioning. So far in this session, we kind of looked at introduction to management. So we reviewed very briefly healthcare delivery system, health ecosystem, and components of an organization. And then we looked at what is management. Before we really want to know actually go as managers. We have to learn to manage ourselves. We looked at management goals, efficiency, effectiveness, and productivity, levels of management. We say first level or the supervisors, mid managers, and top managers. And then functions of management as planning, organizing, leading, control. And then the functional areas of management as marketing manager, quality manager, or the quality management, as well as IT, maybe marketing. So there are a number of functional specialized areas of management. And then we saw managerial competencies. What are the core competencies? We said the competency is all about knowledge, skills, and attitude. And then we converted that into matters of head, matters of heart, and matters of hand. So we need to be skilled, we need to be competent to really perform well and contribute to the organization's performance very well. Then we try to understand that there are responsibilities, but to fulfill those responsibilities and duties, we need to assume different roles. And we looked at various roles of managers, and we studied the roles as given by Mintzberg. And then who are the managers responsible? And so we studied from a perspective of stakeholders and expectations. And best wishes, and thank you all.